Hello and welcome to the COMLEX Instant Review. Let's talk about malabsorption. This is the most common finding in pediatric patients who present with diarrhea, abdominal distension, failure to thrive, decreased subcutaneous fat, loose skin, and muscle wasting. So the hints you want to look for are, if it's early in life, most likely it's congenital. If it's explosive watery, then it's carbohydrate malabsorption. If it's loose, bulky, or offensive stools, then you're thinking celiac, and if it's pale yellow and offensive stools, you're thinking pancreatic. Well, the evaluation is going to include looking for things such as on the stool exam, smear for WBC, history, diet history, WBC count, looking at the qualitative fat, looking at C. difficile, things like that. But let's get into the specifics. If you have carbohydrate malabsorption, and this is a key point for the boards, there will be acidic stools with RS greater than 2 plus. Okay, that's a key point here. And starch and sucrose must first be hydrolyzed with HCl to become reducing substances. Then the breath hydrogen test will ID the specific carbohydrate. So the definitive test is small bowel biopsy for disaccharidase activity. Okay, so for carbohydrate malabsorption, which is a high yield topic that you should understand for the boards, keep in mind acidic stool with RS greater than 2 plus and a hydrogen breath test to find the exact carbohydrate will basically tell you that this is carbohydrate malabsorption, but definitively you have to do a biopsy. For fat malabsorption, you want to look at the stool fat globules within 72 hours. And it's a difficult test to do. And you can also measure the ADEK. So the two things here, 72-hour fecal fat collection and ADEK. For pancreatic exocrine function, you're going to look at the sweat chloride, and with the sweat chloride, before anything else that you look into must be done. So for example, you want to look for fecal esterase, serum trypsinogen. You want to screen for cystic fibrosis very early. So in order to do this, you have to first screen chloride before anything else. Okay, that's a key point. The gold standard, however, is going to be the direct analysis of duodenal aspirate for HCO3, trypsinogen lipase, and that's after CCK and secretin simulation. So pancreatic exocrine function, you want to look at the CL first from the sweat, serum trypsinogen, okay, gold standard, duodenal aspirate for HCO3, trypsinogen, and lipase is the key. Now for proteins, you want to measure stool alpha-1 antitrypsin levels and look for signs of hypoalbuminemia. What about intestinal mucosal disorders? Well, in this case, specific diagnosis requires histological exam of small intestine, and that can be done through mucosal biopsies. That was a quick review for malabsorption for the COMLEX board exam. Please visit comlexflashcards.com for additional lectures, and good luck in your preparation for the boards.